Hello, my name is Mo Ray and I'm Professor of Health and Social Care in the School of Health and Social Care. I also chair the Healthy Ageing Research Group known as HARG. HARG is a research group that is situated in our school and is allied with the Lincoln International Institute for Rural Health and Care and the Health Advancement Research Team located in the School of Sport and Exercise Science. We are interested in research which focuses on ageing and the life course, and our areas of expertise in research include experiences of ageing, healthy adaptive ageing, experiences of care, and health and social care services for older people. We encourage interdisciplinary research with academics from a variety of schools. Our aims are to conduct research to develop our understanding of the experiences of ageing, to develop critical understanding of the notion of healthy and active ageing, to examine the benefits of interventions in health and social care, which are aimed to improve the experience of older people's access to services, to fully involve older citizens and other partners in our research, to develop participatory and collaborative approaches to research with older people, and finally to promote the importance and value of gerontological research and the role of social sciences in ageing research. We believe that our research can contribute to maximising the benefits of an ageing society, as well as considering strategies for addressing its challenges. Dr. Jo Blackwell will now give an example of the kind of research that we've been working on over the past year.
Hi, I'm Jo Blackwell and I'm a Research Associate working with HARG. One of the projects we undertook was a project on physical activity experiences and dementia. We did this because we know that people living with dementia are less likely than others to engage in physical activity, facing significant challenges and fearing stigma. Despite this, it is rare for people living with dementia or their carers, who are also a key part of the conversation, to be asked about their experiences, and especially in a rural county like Lincolnshire. To help add new knowledge, our study involved a scope and review of the existing literature, which then informed a consultation with people living with dementia, carers and with support service providers. We found that people want to engage in physical activity in its many wide-ranging forms, and that there are many things that help and hinder them to do so, such as unobstructed and wide pavements, groups offering failure-free activities, and staff who are empathetic and knowledgeable. This work culminated in us bringing together stakeholders from care homes, community groups, the leisure sector and researchers, and the creation of a network of people who are sharing their experiences, learning from others, and all who have a real enthusiasm to make dementia-friendly changes that support physical activity experiences in Lincolnshire. I'd now like to pass you over to my colleague Thomas George.
Hello, my name is Tom George and I'm a Research Assistant in the School of Health and Social Care and the Healthy Ageing Research Group at the University of Lincoln. The Healthy Ageing Research Group specifically explores research on older adults with a focus on healthy ageing. Older adults are an underserved community where their voices are rarely heard. Through our existing research and partnerships, we found that physical inactivity levels amongst older adults within Lincolnshire are somewhat low. Through an NIHR CRN East Midlands Fund exploring underserved communities, my colleagues and I at the Healthy Ageing Research Group began focusing on research exploring physical activity and ageing in Lincolnshire. As part of this research, we delivered 2 work streams. The first work stream was the Ageing and Physical Activity TAPA network, which was created and included stakeholders from across Lincolnshire, involving older adults, physical activity instructors, personal trainers, health and care professionals, charities and organisations involved in physical activity, and academics from across the university. Our second work stream involved interviews and focus groups with older adults from Lincolnshire, both active and physically inactive adults, and stakeholders from the TAPA network. The research highlighted several key themes associated with the barriers of engaging in physical activity in Lincolnshire, including health conditions, geographical limitations and poor transport links associated with the county. Opportunities were highlighted, including improved social interactions and improved health and well-being. Experiences of being involved in research were also explored. Findings suggested more awareness and involvement of older adults within the research process through co-production is key to capturing their lived experience. We have several health and care professionals who sit on the TAPA network, who through further discussion will be exploring new and innovative approaches to delivering physical activity and exercise for older adults in Lincolnshire within different settings and environments. I'd like to now pass you over to my colleague Louise Marsh.
Hello, my name is Louise Marsh and I'm a Research Associate for Social Care with the Clinical Research Network East Midlands and the School of Health and Social Care at the University of Lincoln. I'm also a member of HARG. My work is essentially around community-based social care provision across the many sectors, including commercial, not-for-profit, voluntary and faith. My brief is to raise awareness of research and help build capacity for this within the social care sector. The lion's share of community-based social care and support is for our ageing society, and this is likely to remain the case for several decades yet. So research in this field is vital and very relevant. In July 2020, we established a research, learning and excellence community of home care providers known as LIIRH. This was set up with the aim to engage home care managers and their teams and users of their services and families in research opportunities to help raise awareness of the benefits and value of research and provide recourse for professional input and development into research. The majority of providers support adults over the age of 65, and so HARG and TAPA networks provided great inroads for interested providers and the people who use their services to engage with relevant and current research, recommendations and evidence. It has been encouraging to witness the enthusiasm despite the extreme pressures social care providers are facing today. There remains a genuine interest in relevant research that is taking place and are willing to engage with the research community and even influence the direction and design of future research projects. Thank you.